This Salt Lake City native is board certified in family medicine and obesity medicine. His keen interest in understanding the complexity of the human behavior led him to get his undergraduate degree in psychology from Utah State University. Woo! He then furthered his education at Touro University in Nevada and received his osteopathic medical degree. Wanting to do more than just prescribe medications, he became certified in obesity by the Obesity Medical Association and now focuses on intensive dietary lifestyle interventions to reduce the common metabolic diseases. Let's give a crazy keto welcome to the creator of the Granger Metabolic Health and Weight Management Department at the Granger Medical Clinic, Dr. Nick Trujillo.
All right, can you guys hear me pretty good? We good? All right, perfect. Thanks for the introduction. Before we get started, I just want you guys to take a second to, big round of applause for Chris and Miriam for putting this together. Awesome. All right. I travel to a decent amount of these, so it's kind of nice to have one right where I'm at. So today what we're going to do is we're going to kind of take a different approach to what you guys have been hearing, if you've gone to different conferences, listened to different lectures and stuff like that. All the stuff that we've heard so far is phenomenal. But I want you guys to start thinking about it in a different way, and I want this to be as impactful as possible. So I want you to try to think about people you care about, think about your own health, and then try to put this in that scenario, or somebody who you wish you want to try to get help for. Because sometimes we want to help somebody else, but they don't want to change, right? So it's important that we know the entire picture, okay? So let's go ahead and get started, okay? So disclosures, none, so don't worry about that. All right, so good introduction. I just want to kind of follow through on this because it'll help you guys understand my approach, my view on how I look at this whole process, because it was kind of a trial and error type thing to kind of see what I like, what I want, what works, what doesn't. So basically, like I said, I went to Utah State, psychology, very fascinated with behavior. I got to train rats and train pigeons to do all sorts of stuff. Really interesting. Decided I wanted to do a little bit more. Went to medical school, went through that. Obviously, great experience, learned a lot of stuff, but also a lot of stuff that really at this point doesn't matter. Okay. Went and did my family medicine down in Scottsdale, Arizona. This was an interesting experience because that's the point where you really get diving into medicine and you get to see how you can actually impact somebody's life. And you see what stuff you've learned in medical school, and also you see what stuff clinically you're supposed to be doing and your mentors and what you're supposed to be following. But at the same time, you also get your own patients. Then you start developing your own practice, your own way of looking at things. Decided when I got towards the end of that I was getting really uncomfortable with patients that had chronic disease and just tons of medications, and they felt horrible, and my guidance told me to give them more insulin, or to put them on more medications, or to do all these different things. And yeah, if you look at all the guidelines, at the very top it says lifestyle interventions. But they don't teach us that, right? We're in med school, we're in residency, that's not part of the training at all, okay? So yeah, I'd like to do that, but I didn't know how to do it, okay? So I went ahead and found the Obesity Medical Association, went down that approach, and learned a lot of really good things. And they do a good job of kind of giving you a blanket training of all the things that are out there and experts in the field. But if you start looking at the evidence, it naturally guides you towards low carb, high fat, because that's what works, okay? And then that led me to kind of negotiating contract with Granger Medical to let me do what I wanted to do, because it is a little bit outside the box, and I guess I just don't like following the rules. All right, so objectives. First off, we need to understand where are we at? Where is our entire society, our country, our state? Where are we at? And it's not good, okay? And then we're going to try to focus this more on your personal experience or somebody in your family or somebody you care about, okay? So what is it that you want? Plain and simple. We're going to keep this very simple, but still pretty deep. What do you want? You need to decide, because that's going to determine what we're going to do, how aggressive we're going to do it, all of that, okay? Why do you want it? Okay? Very important, okay? If you want something but you don't have a good enough why, I mean, we'll dive into that. where are you starting? What's your starting point? Okay, we're all at different points, okay? And we can't just say, oh, I want to change my life, I'm going to do keto, that's it. That's not how it works, okay? What does your journey look like? Okay, everybody's journey is going to be completely different, okay? And to kind of tie it all together, how do we succeed? Okay, whether it's you or somebody you care about, or maybe you're somebody who wants to help inspire other people make change, okay? All right, so where are we now? Okay, I think we can all collectively say that it's not a good place, okay? So we see the storm clouds, it's not good, but we're plowing forward, okay? But we don't see that we're about to just get annihilated, okay? It's just getting bad and bad and bad, okay? I've watched over the last little bit, going to a lot of these conferences, and it's exciting to see how many people are getting into this and making change and seeing more and more providers doing this. So I think that we're going to speed up and we're going to get away from that, okay? All right, so where we are now, we know there's a lot of problems, okay? Obesity, diabetes, okay? Chronic stress, depression, sleep apnea, heart disease, so many things, okay? We can't just say this is a problem. It's not an epidemic, okay? It's not a pandemic. Oh, it is, but it's more than that, okay? We are at crisis level. This is out of control, and it's just getting worse, okay? We have to make a difference. We have to make change now, okay? Let's kind of go through some of these each at a time because I want you guys to have a good understanding of where we're at with each of these things. And we'll try to be quick, but we'll also try to make this a little bit interesting, okay? So obesity. We saw, I'm sure we've all been familiar with these graphs here as we see the trend as obesity raises and they have to make up new colors and rearrange it, and it just keeps going and going, okay? And when we think of obesity, we think of somebody who's really big and they got a lot of weight and stuff like that, but there's a lot more to obesity than that, okay? So think about that. 40% of adults have obesity. So to kind of make this a little more interesting and a little more visual, I want you guys to imagine in this room, and there are some empty seats, but there's about 300 people in here. Okay, so if we were to think about 40%, that means that everybody in this whole front section, okay, that's 40% of the room. Okay, everybody has diabetes or has obesity. Okay, visceral fat. I've heard a couple speakers mention this. Really, 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 really important. Okay, I'll get patients all the time who come in, and they'll be wanting to change their life. They'll be wanting to make a difference in their own and stuff like that. And their spouse is supportive, maybe not all the way supportive, but then they'll make the comment of, oh, well, he's skinny or she's skinny and she doesn't really need to lose weight. Okay, well, does she have a belly? Does he have a belly? Yeah, okay. Central obesity, okay? Visceral fat, very, very important, okay? This is inflammation. This is signs of insulin resistance, okay? We've heard from previous talks, we don't have to wait until you're pre-diabetic or diabetic, okay? There's a lot of signs of insulin resistance going on well before that point, okay? I'm sure some of you guys have heard of this term. I believe somebody mentioned it before. TOFI, okay? Thin on the outside, fat on the inside. This is what it looks like, okay? This is superficial fat. This is visceral fat. This is inflammatory, okay? The majority of chronic disease are inflammatory diseases, okay? Cardiovascular disease is an inflammatory disease, okay? That's damaging the arterial wall, okay? So we need to be very important that we look at this stuff and we realize that you can be skinny in appearance, but still have some metabolic issues, okay? And I'll have patients who look completely skinny and they are uncontrolled diabetics, okay? So don't take comfort in somebody who thinks that you're just skinny or you compare yourself to somebody else. Because when we compare, we are off, okay? When we see somebody who looks maybe overweight, they're probably stage 2 obesity, okay? We've got this twisted view of looking at things just because we've been used to it for so long, okay? All right, type 2 diabetes. This is a big one for me. This one really was hard for me, like I mentioned in residency, because everybody has type 2 diabetes. And I did my training in, we had a community health center. So a lot of patients who don't have many resources, very tight, low socioeconomic status, and diabetes just out of control. I mean, just limbs getting cut off here and there. And I mean, I had patients that I loved and cared about, and we had close relationships, and they'd tell me about how, oh, I got my third toe cut off, whatever, and he'd joke around and have a call, and you just call me number 7, right? And it's crazy, okay? So we need to understand that diabetes, it's a dietary thing. Yes, there is genetics involved for some people, and we're going to be more predisposed, okay? But there's a lot more going on here, and we'll dive into this, okay? So let's do this. This will be a little bit more interesting. So to me, these statistics are absurd, okay? So think about this. 30 million people have diabetes. So that's 1 out of every 10 people. So that means that if this entire back section over here, okay, if that whole section back there were to stand up, that's 10% of this room, okay? They all got diabetes. So those are diabetics up there, okay? And a quarter of them don't even know it. Okay, so they're over there and they want to be positive. They don't even know where they're starting. They don't even know that they're diabetic. Okay, and prediabetes. And keep in mind as we talk about this that this is diagnosed prediabetes. This is not factoring in that long course of insulin resistance that develops before somebody gets that A1C that says prediabetes. Okay, 84 million people. 1 out of 3 adults have prediabetes. Okay, so now if you guys want to turn around and look, think about this back section. Okay, the middle and the left, okay? All of these people up here, those are all of our pre-diabetics, okay? Of all of them, okay, being 33%, okay, if we were to just have maybe 10 of them sit down, those are the only ones that even know that they're pre-diabetic, okay? 9 out of 10 people don't even know they have pre-diabetes, okay? I see this every day, okay? And what's sad is I even see it from people who were pre-diabetic, not that they didn't go see the doctor, because that's a problem too. Some people don't decide they don't want to know. They assume, but it's like, oh, I think I'm fine, I'll make some changes. But I'll have times where they'll come in and they had pre-diabetes for a couple of years. I look back on their labs and nobody ever told them, right? It's just borderline, so the doctor's like, oh, everything's fine, just kind of eat less sugar or whatever, okay? And don't even know their own diagnoses. And the same thing has happened with diabetes before. And I wouldn't say that's a trend, but it's concerning, okay? So back to type 2 diabetes. This is a dietary condition, okay? This is preventable. This is reversible, okay? In the majority of cases, this is reversible, okay? If you are on medications, if you are on insulin, if you are on a lot of stuff, okay? Unless you have done quite a toll on your body, majority of these people are reversible, and you can get off of insulin, and you can get off of your medications, okay? You have to think about the approach of when I'm eating certain foods, I'm choosing to take more medication, okay? If I eat this, I have to give myself more insulin, okay? Before that point, before you're giving yourself insulin, your pancreas is just doing it for you, okay? Because you eat, and then your pancreas is going to kick out more. Okay? So it's really important that we understand this, that this isn't something that you just get, like I caught the diabetes, okay? This is something that we can know your stuff, hey, I got family history of diabetes. I should probably watch myself a little bit, okay? Because maybe I'm a little more predisposed, okay? Totally preventable, okay? Fatty liver. This one's pretty interesting because I'm sure everyone's kind of heard that term thrown around. Okay, this is what it kind of looks like. So we got our normal liver here. This is what we'd call fatty liver. There's better pictures than that, but just to give you some understanding of some of this terminology is going to be thrown around. So this right here, this NAFLD, this is non-alcoholic fatty liver disease. Okay, sounds really fancy. Basically, all it's saying is that there's fatty liver, and it's not because of alcohol. Okay, so we need to understand that this whole fatty liver thing, it's asymptomatic. People don't know they have it, okay? Maybe some of you guys have had it. You've been seen for your gallbladder or some other thing, and they incidentally said, oh, by the way, you got fatty liver. Oh, thank you, right? So we got to think about this. Up to 46% of Americans have fatty liver, okay? 10% of our kids have fatty liver, okay? This stuff is all there. We just have to look, okay? And this isn't something that as a doctor that we're going to say, I wonder if you got fatty liver. We're going to do an ultrasound. That's just not standard. Okay, that's not what we do. It's more times now if we see signs of insulin resistance, it's just assumed you got fatty liver. Okay. Then it's going to take to another step. I'm sure maybe some of you have been seen by your doctor and you were doing some lab work and he showed, hey, your liver enzymes are a little elevated. Okay. Well, unless there's something else going on, if it's just a subtle elevation, majority of the times that's what we call NASH. Okay. So NASH is when our fatty liver kind of goes to the next step, okay? And we see that in maybe about 25%. Basically, this fatty infiltration in your liver, it's in there and it's getting more and more and it's causing inflammation, okay? And even still, people aren't going to have symptoms with that, okay? This is concerning because it leads to scarring, it leads to damage, okay? People don't realize that this is fastly becoming one of the most common causes for needing a liver transplant, okay? From just eating foods that make infiltration of fat in your liver, okay? Not thinking about things like alcohol, but think about it, it's a similar process, okay? So the way we look at NASH is non-alcoholic, steatohepatitis, which is for fat, and hepatitis. So non-alcoholic steatohepatitis, okay? So fatty liver, causing inflammation, not caused by alcohol, okay? Very big issue, and it doesn't get much attention. Sleep is huge, it's absolutely huge, and I think that everybody knows it, but still downplays it because we're just so busy and we don't make it a priority, okay? Sleep apnea, I see this a crazy amount in my office, okay? Because I like to approach things by, and we'll go into this, is about eliminating as many barriers as possible, because honestly, that's really what it's all about, because we want long-term change, okay? So let's think about this for a second. 1 in 5 Americans suffer from sleep apnea, okay? Nearly 80% go undiagnosed and untreated. That's absurd, okay? If you understand the pathophysiology or what's actually taking place, some people think that, oh, I don't snore, so I don't have sleep apnea. Not the case, okay? You can not snore and still have sleep apnea, okay? And if you need to be screened or you have any suspicion that, man, I just don't wake up well rested, I'm not restored, maybe I snore, or my spouse told me that I kind of pause when I'm breathing at night, go get screened, okay? It's a simple test. They put on your finger, check your oxygen while you sleep, and then we can decide if we need to go to the next step, okay? But this has a toll on you, because if you're not getting good sleep, that's going to affect hormones in your body, okay? Hormones that are going to affect your appetite, okay? So as you have poor sleep, elevation of ghrelin, which is a hunger hormone, okay? And you're gonna be hungry, okay? So if you routinely wake up in the morning and you're hungry, okay? You're not sleeping very good, okay? Something's going on. And it's a little more complicated than that, because even good people who want to make change and go see it, then maybe they do have it and they have to be put on a CPAP. That's a whole nother issue. It can be hard to stick with something like that, but it's really important because it has a toll on everything, on how well you can manage your anxiety and your stress, and lead to depression and hunger issues. And I mean, I can't overstate how important sleep is. And if you're a patient of mine, you know I nag you to death about stress and sleep, okay? Insomnia. I think we could collectively say that we have bad sleeping habits, okay? Playing with our phones in bed, watching TV in bed, all sorts of stuff, okay? So this can be an easy fix. I mean, if anybody's ever talked about sleep hygiene, which isn't taking a shower before going to bed, it's about knowing the right habits that actually optimize your ability to sleep well, get into deep sleep, good restorative sleep, and optimize melatonin levels, okay? All right, depression, anxiety, and chronic stress, okay? If you guys hear anything today, I want you to hear this. This is a mental health issue. Our chronic disease, diabetes, all these things, it's mental health, okay? Yes, we're predisposed. Yes, it's dietary, all that kind of stuff, whatever, but it's our mental health that's being affected that's driving us to this point, okay? It leads us to poor, inconsistent eating habits, okay? We neglect ourselves. We're just stressed all the time, okay? We have so much to do, okay? Again, we're not sleeping, okay? And this leads to chronic disease, okay? You can have all the right tools. You're the best at doing keto. You're to the T, macros on point, fats perfect, energy through. You're not going to stick with it, okay? We have to take care of our mental health, and this is a big issue. And I know it's more complicated than that because it makes people have to get out of their comfort zone, right? Especially males, not to single them out, but your average middle-aged male does not want to go in and see his doctor and talk about being depressed. We don't like it, okay? Makes us feel vulnerable, it's not comfortable, and not to say that females aren't the same way, okay? But I do notice a little bit more. Like whenever I see a guy in my office, a little bit middle-aged, maybe some worried about depression, stuff like that, your wife made you come in here, didn't she? Right? Because we just don't want to go in and talk about that stuff, unless it's gotten to the point where we obviously know it's a problem and we need to do something. So it's not always the case, okay? But this is a good visual here. A lot of us are drowning, okay? And maybe you have somebody you care about who you want to have change, who to make a difference like that. But they got so much going on, okay? And if you're like, say, an average patient that I see, you hold on to all of it. And you don't share it. You don't tell everybody. Even some of the closest people to you have no idea that their partner is severely depressed or had some very traumatic things happen to them in their early childhood. And they've never even mentioned it to you, okay? This stuff is huge, absolutely huge, okay? Suicide. We're going to touch on this really quickly because it's becoming a bigger and bigger. It's always been an issue, but it's becoming a bigger and bigger issue. So let's go over this really quickly. According to the American Foundation of Suicide Prevention, 10th leading cause of death, okay? There's about 129 suicides a day in the US, okay? 1.4 million suicide attempts in 2017, okay? Most common cause of death between the ages of 10 to 24, okay? This is our next generation. These are the people that we care about, that we want to grow up and make change, and if we want to carry on this momentum of nutrition and lifestyle change, whatever, these are the guys that we need to be treating and teaching this stuff, okay? And their mental health is in a very bad place, okay? But they're also living in a very unique place. Things have changed, social media, computers, and Instagram, and all these different things, and it's really, really hard, okay? And I think a lot of parents have a hard time connecting and communicating with their adolescents. Not that they're not trying, they're trying as hard as they can, but we don't have the right approach. It can be counterproductive, okay? The main connection I wanted to make here is this stuff over here, okay? How much does diet and lifestyle affect this, okay? Some pretty interesting studies. If you look at this one here from the Canadian Journal of Psychiatry, young people between the ages of 15 and 30 living with chronic illness are 3 times more likely to attempt suicide than their healthy peers, okay? Australian studies showed that the rate of suicidal thoughts was 7 times higher in adults with type 1 or type 2 diabetes, okay? I'm not saying this is the answer, but it's a big part of the problem, okay? And we need to take it really, really seriously, okay? I think we're past the point of just focusing on suicide awareness, okay? We need to understand that we need to get to the bottom in the prevention and intervention and help our adolescents and our young adults be able to communicate how they feel, because a lot of them just don't know how to do it, okay? Or maybe they don't feel safe enough to do it, okay? And it's a scary place. All right, so we've gone through that. Let's kind of brighten it up a little bit. So we can all agree that it's a time for change. Agreed? Okay, so as doctors, and again, I'm still pretty fresh in the realm of being a doctor. I've been practicing for the last 6 years, which has been nice because I've been able to see how it has been done and how it is maybe about to be done. But there's a lot of resistant doctors, okay? And it's complicated, okay? So don't just automatically think that doctors don't want to give you the best information, stuff like that. It's complicated, and like I said at the beginning, I think a lot of what I do is based on the fact that I maybe don't like following the rules, okay? And sometimes that's a good thing. If somebody tells me to do something that I really want to do, but they told me to do it, now I don't want to do it anymore, okay? So maybe a little stubborn too, and maybe you can ask my wife, okay? But anyways, we've been giving bad advice, okay? I don't think it was intentional, okay? We have guidelines that we're supposed to go by, and when you go through training, it's like, hey, here's your JNC guidelines for blood pressure, okay? Here's what the American Heart Association says. And so we value these things, and we feel like, well, I want to be a good doctor, and American Heart Association, that sounds pretty reputable. Let's make sure I tell my patients whatever that is, okay? But once you get in the trenches and you actually see the patients and you see the change and you see how they feel and you see they don't want to be on another medication, okay, everything changes, okay? And especially when you start making change with them, It's really, really empowering, and it's really, really exciting, okay? All right, so if you're going to start a journey, whether it's you or you're thinking about somebody else that you want to inspire, again, simple. What do you want? Okay? You can't just say, I want to be healthier. Okay? Be specific. Okay? What do you want? I want to have better health. I want to live longer. Okay? Great. Okay? I want to lose some weight. How much? Okay? And how fast? Okay? Medications. I'm sick of being on so many medications. Please, 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 please help me get off these medications. Okay? We feel like prisoners because if you're a good patient, the doctor says, you need to be on this, then you say, yes, doctor, right? And we take it, okay? Even if half of you stop taking it when you get home anyways, okay? Whether you're a good doctor or not, I think it's a pretty universal thing that there's a level of respect for somebody who holds the title of a physician, and that they should know the best evidence, they should know what is best for you, and so you go in there vulnerable and you trust, okay? And again, I don't think that the things that they're doing are intentional. Okay? It's just way more complicated than that. Okay? Pain. Maybe you want less pain. Okay? You feel like your weight or your health, whatever, is affecting pain. Okay? Maybe you just want to be happy. Okay? I want you guys to think about the fact that happiness can happen anywhere. Okay? There are people who are 100 pounds, 150 pounds overweight, and they are as happy as can be. Okay? It's all up here. Okay? If you think, oh man, if I get that last 20 off, then I'll be happy. No, be happy now, okay? It's all about how you look at it, okay? Self-esteem is a big one. I think that's something that everybody kind of struggles with because there's a lot of, again, exposure out there of what we should be like, what we should see, all that kind of stuff. So, and then you throw in things like, say, social media, Instagram, all that kind of stuff, and people get on their phones and all day long they're like, oh, I'm not good enough, I'm not good enough, I'm not good enough, because we're just constantly seeing all these things that we are supposed to be, or we're supposed to be doing more, supposed to be doing this kind of stuff, and it's hard, and it can lead to a lot of the mental health issues, okay? So, plain and simple, what do you want, okay? And after doing this, I actually had the idea of putting up a picture of The Notebook. Yeah, I'm not ashamed, I've seen The Notebook, okay? I forget the guy's name, the character, whatever, but what do you want? What do you want? Sometimes how I feel sometimes with patients. It's like, I know they want to change, whatever, but what? Like, what do you want? Not in a bad way, but just like, help me, okay? Because it's going to help me be able to know how to do this best for you and make this work, okay? So simple. What do you want? Why? Why do you want it? Seems like a reasonable question, okay? What drives you, okay? I see a lot of, say, middle-aged females or even getting a little bit older, and they're phenomenal parents, phenomenal spouses, and all that kind of stuff, at the expense of themselves. Okay? They neglect themselves, okay? And they do all these things to help everybody else, and they don't take care of themselves, okay? Some of those people have a really hard time having a good why for themselves, like, I'm going to do it for me, because they have stopped thinking about themselves for so long, okay? So in these situations, you have to dig deeper. You got to find something that you can anchor on, okay? Because doing it for me will last for a little bit, but a lot of times it won't stick and it won't be enough, okay? So you got to find that why, okay? I really like this quote. He who has a why to live can bear almost any how, okay? Absolutely agree with that, okay? So things you can anchor on. Maybe you already know you want. I want to take my A1C and I want to get under 7, okay? Not over-aggressive, but that's what you want. I'd say lower the better. Let's make it go away, okay? Or maybe you want to have less medications, okay? You already know what you want. Why do you want it, okay? Well, you know, I feel better if I was off the medications, or I think that has a lot to do with my fatigue, or, you know, I want to live long enough to see my little grandkids get married, okay? I want to not have a heart attack, okay? When I see a middle-aged male jogging down the road, unfortunately, from my experience, I always get this feeling of, oh man, he probably just found out that he's diabetic, or that he has heart disease, or something like that. Very rarely am I thinking that, oh great, motivated, awesome, right? He just wants to do it, right? Because sometimes we sit here and we wait. We go to work and we stress and we get through all the stuff, whatever, and we wait for something to happen. oh, I had my first heart attack. I'm going to go start being healthy. Okay? Prevention, prevention, prevention. Okay? If we want all this stuff, if we're here to learn, if we're here to make change, okay, don't wait until you get the bad news. Okay? Don't wait until you're pre-diabetic or diabetic. Okay? Figure out what you want and why you want it. Okay? Maybe you want to be at one of your kids' weddings. Okay? It's scary. Life is scary. It's short. Okay? And we need to start understanding that the best way you can take care of the people you care about is to take care of yourself first. All right. So, where are you starting? We all have very different starting points, and this is going to affect my approach on how I guide you. So maybe you are absolutely, without a doubt, depressed. Okay, it's just a really bad place. Maybe it hasn't been diagnosed by a doctor or whatever, but you know something's not right. Okay, maybe you have chronic stress. Maybe you got a job that you think is right. You're supposed to be doing that. I'm pretty sure that's what I wanted to do, but you just feel horrible. You're just stressed all the time, and you have all these reasons why I can't do this, I can't do that because I'm so stressed. Okay, maybe you are bogged down because you're carrying somebody else. Okay, I see that a lot. Okay, maybe you just got way too much baggage. Okay, we all have baggage. Okay, it's just a matter of how visible it is and how much that person specifically wanted to let other people know. Okay, you see people that you interact with every day who are happy and cheerful and stuff like that. You don't know their story. Okay, a lot of them are putting on a front and it's exhausting. Okay, or maybe you're free as can be. Maybe you got nothing, no obstacles, no nothing. Just like, I just been eating unhealthy because I like unhealthy food, but nothing's stopping me and I'm ready to go. Okay, you can see how these are all going to have different approaches. Okay, huge, huge. If you guys haven't heard about the book Mindset by Carol Dweck, read it. Phenomenal book. Okay, this is hard to teach. This is hard to teach, but so big when it comes to lifestyle change and really when things click and you're just trying no matter what. Okay, you have to know that challenges happen. Okay, get better. Okay, there are not just set things you can do. Okay, you need to kind of get out of that realm of things that you think that you can't do, or I'm not this person, or I don't do that, or that kind of stuff, whatever. It's fixed-minded. You have to understand that if you want change, do as much as possible. If you don't read, I don't care. Read more books. Okay? If you don't exercise or have never exercised before, I don't care. Okay? Not that I'm not going to be rude about it, but I mean, let's start simple. Let's walk. Okay? Let's walk more. Get this pedometer. Let's start walking more. Okay? Just understanding that a lot of this is we need to understand, if you think about successful people, people that have made huge changes in their life, or businessmen, entrepreneurs, whatever it is, they've got a growth mindset. Okay? Where things don't stop them. Okay? They drive them. Okay? Think about things like David Goggins, for instance. If everybody knows him, guy's insane. Okay? Growth mindset, insane. Okay? Or Tommy Caldwell. I had to mention this just because I think it's phenomenal. I don't know if any of you guys have seen that. It's a documentary about a rock climber. Okay? This is El Capitan. Okay? And this is Tommy Caldwell. Okay? Phenomenal rock climber. And if you guys know anything about rock climbing, anybody here rock climb ever? No? Not too many rock climbers. Okay. Well, I used to rock climb, okay? And so I can appreciate this a lot, and maybe you guys won't appreciate it as much. But there's a section of this rock right here. It's called the Dawn Wall. It's never been climbed, ever. Okay? This guy decides that he's going to be the first person. But even before he even decided that, the guy lost a finger. Okay? If you know anything about rock climbing, when you have a big hole, you hold like this. A small hole like this. If it's really small, you have to put your thumb over and you bank on that finger, specifically that part of that finger. That's the part he doesn't have. Okay? That doesn't stop him. He's got a growth mindset. That's not going to stop him. He knows what he wants, and he knows why he wants it. Okay? 19-day ascent up this wall. Okay? Probably the most successful sport climb ever done. Okay? If you got some free time tonight, watch the documentary, Dawn Wall. Okay? Put yourself around motivating, inspiring people that are doing incredible things. Okay? Keep going with this. Where are we starting specific to you? Okay? We got to know where we're going. Okay? Which way are we facing? Okay? This means if you think something's off, go see your doctor, okay? Do some screening. Maybe you are depressed, maybe you're not, okay? Maybe you're anxious, maybe you're just in a bad place, okay? Maybe you're just holding too much down deep, okay? Where are you starting? Go do some blood work, okay? It is hard. It's hard to find doctors who are willing to do a lot of testing and really do a lot of intervention and stuff like that because, again, our system's broken. It's broken. I don't think our doctors are broken, but our system is broken, and our doctors have to adapt to a broken system, okay? So you need to find out where you're starting. Are you pre-diabetic? Are you diabetic? Do you have significant signs of insulin resistance, okay? I mean, we looked at those stats of prediabetes. Think about if we had those stats for insulin resistance. It would be insane, okay? There's so much, okay? Well, I guess we do have those statistics, but it is insane, okay? Diabetes, it's ahead almost for everybody, okay? I get a lot of kick out of this photo right here because a lot of times, say somebody's closed-minded or just in their mind, they don't think they can accomplish it. They think they're tired, they think that they can't go anywhere. It's all up here, okay? I mean, if you think you can, you think you can't, you're right, okay? One of my favorite quotes, okay? So let's talk about some unique barriers, okay? So I see a lot of these in my office. So poor sleep, like I said, poor sleep and stress I talk about a lot, okay? Binge eating, really common, specifically binge eating disorder. Probably the most common eating disorder there is, okay? And in order for people or patients to open up about this kind of stuff, you have to make a non-judgmental environment. And I think that's one way that our clinic has been very successful. And again, I don't want this to be about my practice or you guys coming to see me. I want you guys to change. That's it, okay? We try to make a very non-judgmental environment because that's where people are going to be open to be vulnerable and talk about this stuff, okay? Depression, too busy. I don't buy the whole too busy thing, okay? It's priorities. That's all it is, okay? Anxiety, no motivation. Again, that's maybe a couple steps down the road. Why no motivation? Maybe you got untreated sleep apnea. Maybe you're depressed. Maybe you got other stuff going on, okay? Maybe you're carrying somebody else and you're getting tired, okay? No support system. This one's hard, okay? In that situation, you have to find a new support system, okay? Still love the people you care about, but at the same time, you have to get out of these toxic environments, okay? This can be really hard because we have a lot of people we really care about, but they're absolutely toxic situations, okay? PTSD, unfortunately, a lot of trauma, okay? I'm not sure if many of you know much about the ACEs study. Basically, ACEs stands for Adverse Childhood Events. Basically, it does some studies to show a correlation between how many adverse child events have happened in somebody's age from 1 to 18 and how that correlates with chronic disease, okay? Marital issues, very common. I think it should be standard that if you get married, or even before you get married, I get marriage counseling, okay? I got people who've been married for 40, 50 years, and there's no communication, okay? Really, really important. Weight gaining medications. Maybe a lot of you guys don't even know you're on medications that drive the problem you're trying to reverse, okay? So again, more information, knowledge is power. The more you can get, the better, okay? Fear of failure, this one's hard. Sometimes we just don't start because we're afraid that we're gonna fail, okay? Financial challenges, I'll hear a lot of things, maybe eating healthy is too expensive, that stuff. I would say eating unhealthy is too cheap. It shouldn't be that cheap, okay? A hamburger shouldn't be $1, okay? Okay, picky eaters, that can be challenging. That can just be more of a kind of a fixed mindset, and we can get over that. Not everything, some things just aren't gonna change. Lack of knowledge, again, we talked about that. Bulimia, anorexia, those things tend to pop up as well, okay? All right, so this is a unique little drawing that I made up and I go through with some of my patients. I think it's kind of fun and it gives us a visual of this whole process, okay? So, let's look at this. This is us, okay? So basically we're here, we wanna be here, okay? This is our health journey, okay? From here to here, this is a gap in skills, tools, and knowledge, okay? You got a lot of obstacles ahead of you, okay? A lot of things you gotta overcome, okay? And a lot of really important lessons you're gonna learn in here, okay? But before you even think about that, like people come see me in my office, they're ready to start climbing mountains. Let's do this. I'm here. I've been waiting, and let's do this. Let's climb mountains. And I'm like, all right. But you're chained to a boulder, okay? And you're carrying way too much stuff, okay? And if we don't focus on this stuff, if we don't start identifying and eliminating barriers, you're going to make progress, but then it's going to become too much, and you're not going to be able to make it, okay? My goal 100% is long-term success, period, okay? So we got to be realistic. Are we starting here? Are we starting here, okay? How much baggage do we have? What is it? Is it untreated sleep apnea? Is it uncontrolled anxiety? Is it depression? Is it trauma? Is it no support? What is it, okay? So that we can start making plans. We can't make it all just go away, right? But we can at least start taking steps, okay? Because once you start getting rid of some of this stuff, this gets way more enjoyable, okay? Another important thing I want you to notice here is that there's a lot of ups and downs. And again, there's some subtle things in here that I don't need to mention, but things I go over with my patients. But mainly is you're going to fall. You're going to mess up. It's going to happen, okay? You're not going to be perfect, okay? So every time you fall, take that as a time to learn something, okay? Don't think you're going to be perfect, because if you do, then you're going to mess up, and then you're going to be like, oh, I might as well just do whatever, eat whatever, okay? Be optimistic that you're not going to fall, and then when you overcome something challenging, you're going to feel empowered, okay? But if you don't and you fall, learn the lesson, okay? This guy, this is our weight loss surgery. I don't have a problem with weight loss surgery, okay? I think it can be very life-changing for a lot of people, okay? My problem lies in the fact that this person is getting a ride from here, and you get dropped off over here. It's not the easy way out, okay? It's challenging. It's just a different kind of challenging. My problem lies in the fact that this person is missing the lessons, okay? They're missing the struggles. They're missing the ups and downs. They're missing the things they need to learn that's going to make them be able to stay here, okay? So if you've had weight loss surgery, if you've made change, whatever, you need to go back and learn some lessons, okay? Very, very important. All right. And I like to put the sun in here just to emphasize the fact that we can be happy at any point in this journey. Yeah? Let's go through some scenarios real quick, and I'm running a little low on time. What would you do if you knew you wanted to climb Mount Everest? Okay? What would you do? Okay? I'll tell you what I would do. I would read about it. I would study it. I would know everything I can absolutely know about climbing. Okay? I'd watch every documentary. I would go climb every mountain I can think of that's not Mount Everest. Okay? And I would put myself around people that have done it, or are doing it, or inspired, who are driven. Okay? I'll tell you what I would not do. Decide that I want to do that, and then just go do it. Okay? What do you want to do if you want to learn Spanish? Okay? You could go buy a Rosetta Stone. You could go take a high school course once a week. You learn some stuff. Okay? Or you could be a little more aggressive. Okay? You want to learn Spanish quick, go move to Mexico. Okay? You're going to be forced to get outside of your comfort zone. You're going to be forced to learn faster. Okay? So let's put this in this perspective here. What would you do if you wanted to change your life with diet and lifestyle? I think a lot of us just recklessly decide, oh, I want change now, and then we just go. Okay? It's a bad plan. Okay? Even if, like I said before, keto is great, how much do you know about it? Okay? Do you know the best way to do it? Is it for you? Okay? What do you know about yourself, right? If you were going to go climb Mount Everest, you should probably go see a doctor. Maybe you got some stress fracture somewhere. Maybe you got some arthritis that's going to take you down in the middle of it, okay? Maybe you need to know about your own personal health and cardiovascular health, all these different things, okay? Same thing here. You need to think about the things we talked about before. What do you want specifically? What do you want? Okay, because if we look at my journey, or our journey, that's going to be totally different if somebody just wants to get a controlled diabetes or they want to have no diabetes. Okay? Why do you want it? Why do you want to climb Mount Everest? Okay? You have to know this, okay? Go read some of Simon Sinek's work, okay? You need to know your why. Where are you starting? Important. So you can understand that your successes at the beginning may not be scale successes, okay? Maybe they can be just getting rid of baggage and barriers and all that kind of stuff. okay? So we're at a low-carb keto conference. Let's talk a little bit about keto, okay? So the way I look at keto, and again, let's get to this in a second. So first off, we were mentioning about Everest. If I was going to climb Everest, I would put myself around as many of these people as possible, okay? Because they're going to raise my bar, okay? They're going to help me believe that I can do things that I thought weren't possible, okay? I'm going to move to Mexico. I'm going to be that guy, okay? Because that's what I'm going to learn. That's what I'm going to do as much as possible, okay? So for me, going through training, seeing nutrition changes like that, whether you've lost a lot of weight, gained a lot, whatever it is, like as a whole, we don't know very much about nutrition, okay? And it's kind of sad. I like keto because it's a crash course. It's full immersion, okay? This is me moving to Mexico, okay? You start keto, okay? You're not going to do it perfect. You can pretend like you're going to, but you're going to mess up. That's okay, because you're going to learn something, okay? But, and again, before when we were doing the what, the why, all that kind of stuff, we try to get people off of sugar and wheat because those are just troublemakers, and that'll kind of gradually get us into this. But when you start somebody on a ketogenic diet, okay, it's full immersion. They have to learn nutrition, okay? If you're going to do it successfully, you have to kind of understand it. You got to know, what's a food label? What does it look like, and what do these things mean? Okay? Who knows where starch is? What is starch? Okay? These kind of things, okay? And understanding how much this stuff has to do with insulin resistance, okay? So we'll do this, and I'll have people kind of go through this, and there'll be a steep learning curve, and then we'll fine-tune it, okay? That's why I really like keto. The other reason I like it is because if I were to make up a diet, it would be a diet where I'm not hungry, I eat really good food, okay? It reverses all of my chronic disease, okay? And I feel good. Okay, this is just food. It's just food, that's it, okay? And like I said, not everybody I'm on keto. Real quick, this is an analogy I use for keto. It's like rolling a bowling ball down, right through the middle. Say these are like maybe some of your issues. Maybe you got some chronic pain, some other things, all that kind of stuff. Keto tends to just knock out a whole bunch of them. So it's kind of like, oh, you got all this stuff going on? Try this, boom, right? And majority of them go away. Then there's maybe a couple that are lingering, and we'll focus on those separately, okay? But keto can be so powerful for some people, okay? So let's kind of break this down. I think I'm totally out of time, but I'm going to wrap this up real fast. Hopefully that's okay. How do I succeed? You have to know what you want and why. Be specific, okay? You got to create a positive environment around motivated people, people that are doing things like this, people that are making changes, who have already made changes, okay? If you're not in a positive environment, if you're around people who aren't pushing themselves, who are negative, who are toxic, whatever, you're going to struggle to make it. And it doesn't mean you have to leave these people, just make healthy boundaries, okay? Remove and minimize barriers, absolutely critical. If you want to help other people make changes, teach them that they need to identify the barriers, they need to address these, okay? Own your weaknesses, we all have them, it's okay, don't be ashamed. I have my own weaknesses, okay? And I tell my wife not to buy those things, okay? Because if they're in my house, I'm going to eat them. Okay? Own your excuses and your behaviors. We all have excuses. They're just excuses. Okay? Own them. No, we're all different. We are all very different. We have everything is different. Keto may be perfect for you. It may not be perfect for somebody else. That's okay. Okay? I like low carb. I like real food. Okay? Not all my patients are on keto. Okay? Don't compare yourself to other people. Guys are going to lose weight faster than girls. It's going to happen. Okay, so if you start with your spouse, he's going to lose weight faster than you. It's okay, right? Don't read the internet about how I should have lost 25 pounds in the first week. Like, I'm doing it wrong, okay? Everybody's different. Self-experiment, okay? Really important, and you've heard of that a lot here. Be vulnerable. This one can be very challenging, but it's critical. If you don't know who Brené Brown is, you need to know who that is, and you need to read her work, because this is huge. This is one of the reasons why we don't see our doctor, why we don't address things, why we don't address our mental health, okay? Because we're afraid of being vulnerable. We don't want to come off as weak, okay? When really this is strength, okay? My patients coming in to see me and talking about the things that are so personal. It's strength. That's not weakness. Nurture the growth mindset. Accept the fact that you're going to struggle, you're going to fall. It's going to happen. What are you going to do with that, okay? Absolutely no matter what, get back up, period, okay? Learn the lesson. There's always a lesson to learn, always, okay? Don't stop. That's what this is all about. You're on that journey. As long as you tell yourself you're not going to stop, you're going to win, okay? I can, I will, end of story. That's the approach you have to have. That's the way you have to look at it, okay? Just to kind of wrap up, because this is my last slide here. Like I said before, the take home I really want you guys to take is that we have a huge problem, a crisis, okay? And we've got some pretty interesting things going on right now, but I need you guys to realize it's mental health. Mental health is huge, okay? I wear a lot of hats in what I do, and I think I put it on myself because I really like psychology, okay? But we need more mental health resources, and we need to be vulnerable enough to go seek help, okay? Shameless plug, not in my disclosures. However, this is a nonprofit that I'm starting. If you connect with my message, if you connect with things that I look at, that's what we're doing here. So if you want to follow us, you want to help us make change and help other people, that's kind of what we're doing. And that's what I have to say. If you guys have questions, I'd be more than happy to answer. Thank you for your time.
Dr. Nick Trujillo.